So if you have a condition of a soft tissue injury like lateral epicondylitis or medial epicondylitis, otherwise known as tennis elbow or golfer's elbow, these can be extremely difficult to get over and can be long-term chronic musculoskeletal injuries. The combination of deep tissue laser and the Rocktape is a fantastic combination for healing. So with the laser, I use the massage ball head. So if I'm dealing with lateral epicondylitis, I'm actually going to go very lightly right over the lateral epicondyle where the swelling or inflammation is and most of the pain, because they got inflammation to the tendon. And then I'm going to use this and go down into the muscles of the forearm, the extensors. And this is one where I can add a lot more pressure. So I'm actually going to cradle the arm from behind, and then I'll come in from the front, so I can have counter pressure pushing this way and then them going down, so I can really get a nice effective release in that area. And I'll just gauge patient response to what they're feeling, and then I'll actually stop and I'll move the massage ball head around a little bit and release some of the trigger points or knots or adhesions that I feel in there, and then go all the way down. So you can see the difference if I'm doing this as opposed to that. It pushes back in and away. So this is a very great way to get feedback from the body and extra counter pressure. And I will also have the patient do some flexion and extension with the wrist. So she'll go into extension to what's comfortable and then go down into flexion as I'm going through the forearm muscles as well. And make sure you go all the way down to the wrist. So if I'm dealing with medial epicondylitis or golfer's elbow, it's the same exact technique, but now I'm going on the inside here. I'm going to cradle right around the ulna, do my isolation, and then I'm going to apply the counter pressure this way. So I'm going to come in from here and go up inside the arm and work more of the flexor tendons of the forearm. So now I can move this around here, gauge patient response, and then she's going to go into flexion and extension again. So now I can do the inside. Alright, so once we do our laser therapy, we're going to lock it in with some Rocktape. And this one, we're going to actually stretch the tissue, not the tape. So if we want to do the lateral epicondylitis, we're going to start right above the lateral epicondyle, go down into the wrist a little bit, even into the back of the hand. So what I'm going to do is lay down the anchor point, and now we want to stretch the tissue. She's going to come out, she's going to come in like that. And then I'm going to be able to guide the tape and move it into the extensor. It's going to go down into the wrist a little bit, down to into the back of the hand. And this is going to give you a lot of support into the extensors, because a lot of times you'll find very weak finger extensors in relationship to wrist extensors that do too much. So rub that down, and then right where the center of pain is, so you just ask the client, where do you hurt the most? Wherever they put their finger is where you're going to do that decompression strip. So if it's right here, then with decompression we tear in the middle, pull both ends away, stretch 100%, back off half, lay it right down over that top, rub that down, don't stretch the ends of the tape, and now what you're going to have is a nice support to the area that has most of the swelling and inflammation, more stability to the wrist and the elbow, and a reduction in pain in combination with the laser long after they leave your office. So if I'm dealing with medial epicondylitis or golfer's elbow, I'm going to tape right over the point of inflammation and swelling. I'm going to stretch that tissue, and so what we're going to do is turn the wrist a little bit here with the tape right over and above. Lay the anchor point down. You're going to point right to where they hurt, where the pain is. Decompression strip, very simple. Tear down the middle, stretch 100%, back off half, rub down the center, don't stretch the ends, and then good to go.